Hi YouTube, good time of the day. The question we're going to discuss today is very broad. Vitamins for the pandemic. Which vitamins and supplements make sense to take? It's a very broad topic. I'll try to go to the point, so bear with me. Again, the question was more about the data and experience. So if I'm going too fast, please rewind and then watch again.
Hi, I've been coming here for a little while, but I received some therapy that really helped me a whole lot. I used to wake up with headaches, go to sleep with headaches, and I received a treatment that for the very first time I woke up without a headache, and that was a blessing to me. I mean, I could.
Hi, I'm Gary. I wanted to talk to you just a few seconds today to tell you what I've been through and how Dr. Mongolian has helped me. If you're in pain, you need to come here. I've been to several doctors. This is the first place that I have found relief. I hope to meet you out in the waiting room someday.
Hi, I'm Ellen, and I've been a patient of Dr. Margolin's for around 4+ years. And Dr. Margolin is a marvelous physician. He's personable, approachable, kind, but most important of all, he's an exceptional physician. And he's helped me. If it wasn't not for Dr. Margolin, I don't know what I'd be doing right now, probably.
Dr. Margolin told me about the medication Zinc, vitamin C, D, and Zinc. And on the floor in the prison, 160 inmates were sick with COVID, and they couldn't recover. And I told them about the vitamin C, D, and Zinc, and now all of them are doing better. All of them are up and they're active, and they're all extra grateful about learning about the Zinc.
Yes, I'd like to let everybody know this is a great doctor. Dr. Margola has treated me since June of 2020. I've lost about 10 pounds since coming here. I mean, he's absolutely great. I would tell anybody, to come here, and he helps you with your pain, and you walk out the door in a few months feeling wonderful.
All right, so as the time goes by and we're getting close to vaccination, we're understanding the limitation of all the methods and means we have to combat the virus, and the importance of immune boost and general well-being. The question is about supplements and vitamins that we raised a long time ago, 6 to 8 months ago, getting more and more attention. The superstar, of course, in terms of data, is good old vitamin D. This is 50,000 units of vitamin D. This is 10,000. This is vitamin D combined with vitamin K2, 5,000 units. Well, there were several studies. I mentioned them in previous videos that show that vitamin D is effective in immune boost and has anti-inflammatory properties and decreased mortality from all causes. So that's pretty strong. The question is how much to take. Watch my previous videos, book answer, get your levels, and then go to your doctor. He will tell you. If it's not possible and not practical, usually during pandemic, we recommend between 2,000 to 5,000 units a day. Some people say up to 4,000 units a day. You can contact your physician. Again, everything we give you, everything we share with you here is general medical knowledge. You need to contact your physician. For kids, there is sublingual vitamin D3, 5,000 units. Give them once a week for older kids. Or there is 1,000 units chewable tablets you can take daily. Again, there are a lot of different preparations. I don't have any commercial interest of any kind. I also want to mention that there was a study that showed that vitamin D2 also is effective in immune boost. So people who are exposed to the virus and don't have time to wait for D3 to convert to D2 through liver pass can take D2. The next vitamin is vitamin C. There is a lot of data about prophylaxis and preventative properties for respiratory diseases. The recommendation we made 6 to 8 months ago, about 1 to 2,000 milligrams, is still valid, and we don't notice any concerns or side effects. Again, people with kidney stones, radiation therapy, special cases, contact your physician. Next, what about good old zinc? This is zinc sulfate, which is liquid. You can titrate it. This is L-Opt zinc. It's a different formulation. Supposedly has better availability. We presented a study in Frontiers of Immunology. There are a lot of others that suggest that zinc can be helpful. Reasonable dose 25-30 milligrams, less for kids. It's higher than regular dose, which is 11 milligrams for men and 8 for women. But during the pandemic, it is justified. And so far, I'm not aware of any significant side effects. There is a slight possibility of copper-induced anemia, which you can take care of by taking once a month copper supplement. I haven't seen it. I know it's described in the literature. There are also some speculations about more severe side effects from zinc, which I've never seen. And publications actually do not suggest any significant side effects in doses less than 40 or 50 milligrams. That's why 25-30 milligrams a day is fairly safe. And also for a limited period of time. If you take it for a very long time, like those of us who have been taking it for 10 months or more, maybe we need to reassess it. But so far, I've not seen any problems. But as you remember, you need ionoform. You need to push zinc inside the cells. Quercetin is being studied. My understanding, there is a clinical study going underway. Our experience is so far positive. It's not been studied very well for taking for a long period of time, but I'm not aware of any side effects. However, people with low thyroid or allergic reactions should consult a physician. Doses usually between 500 to 800 milligrams a day. Some people take 1 gram, but not more. Okay, what else? From what we recommended, we're left with several other choices. First of all, vitamin E. Vitamin E, interestingly, did not get a lot of attention. I know they've been using it in China. Our experience, take with caution. This is very strong, 1,000 units. You can take it once a week or once in 2 weeks. Remember, it's a fat-soluble vitamin, so if you go wild, you can take too much. But if you stay within reason, which is hard to define, between 50 to 200 units a day on average, you will be fine. Again, if you take it for a long time, consult your physician. Now, let's talk about something called second-line supplements. We're going to do it in the second part of the video. All right, in the second part of this video, we're going to discuss additional choices and second-line supplements. First, I want to mention good old quinoa we discussed. We have good experience, pretty safe. We had a small publication about it. It's possible ionophore for zinc can be used together with or instead of quercetin. Now, talking about other additional supplements, surprisingly, I would first mention ashwagandha and relaxol. These are natural anti-stress agents. Remember, stress not only very difficult to bear, interferes with good decisions, but it also immunosuppressant. If you get rid of stress, your immune system works much better, as well as your mind. You can also use good old valerian root and other non-sedative, non-scheduled herbs or supplements. Okay. Well, I would like to also mention probiotics. Remember, 80 or more % of your immune system is in the gut. Prayer and probiotics is a great idea. I also want to remind that good old sauerkraut, if it's fermented, like Bobby's and others in other natural companies, it's a good pre and probiotic. I would also want to mention vitamin B complex. It makes sense, especially for people who may be deficient or who had the virus, for example, but they had taste and or smell loss. It has a role in neural damage, regeneration. Studies are pending. Downside is very low. What else? Surprisingly, melatonin. A pretty big review by Cleveland Clinic on 11,000 patients shows that melatonin may have a positive association with the reduced frequency of COVID based on its interaction with the receptor or anti-inflammatory properties. I would also want to mention alpha-lipoic acid, again, mostly for people who are concerned about neurologic symptoms or have them after COVID, such as taste loss or smell loss. All right, what else? Good old omega-3 being studied for a role in COVID. Again, especially smell or taste loss and general well-being, and generally has a positive effect on the body. NAC or NAC, N-acetylcysteine, there were suggestions that it can possibly help for post-COVID syndrome. It's being studied. I haven't seen a clear proof, but the downside is low. It's debatable whether you should take it as prophylaxis. Again, the downside is low. There is also speculation or suggestion that it may interact with von Willebrand factor and decrease microthrombi. And the last one I want to mention is selenium. It generally has immunomodulatory effect. It boosts your immune system and fairly safe in the 200 microgram dose. We're not aware of any side effects. And again, I want to mention that there are much more, and there are many other supplements, but you want to stay sane. You want to take supplements regularly. The more you add, the more difficult it becomes. And don't forget about good diet, good exercise, staying positive, and putting it together in a kind of good plan which is realistic and can be effectively implemented at home. Thank you again for this question, and thank you to everyone who supports this channel, and hope everybody stays safe and healthy.